Welcome and good morning, everyone. Happy to have you here on this wintry Wednesday morning here in Wixom. There's a lot of W's here in that sentence. Broadcasting here from Southeast Michigan, western side of Oakland County here today. Welcome to everyone, though, no matter where you're coming from. My name is Randy Lober. Had to think about that for a minute. My name is Randy Lober, Learning Development Specialist here at Action Benefits, and happy to have you along for today's session, keeping it rolling with first quarter follow-ups. Use Q1 as the abbreviation there because it looked better on the slide. As a learning development specialist, I know a little about a lot of stuff. Joining me here today is Becca, one of our account managers from our individual team, and she'll be helping us get into some deeper details on some things. Becca, I want to give you a chance to say hi to everyone before we get started.
Good morning, everybody. I hope everybody is staying warm today. It is a cold one. Like Randy said, my name is Becca Nyson. I'm one of the account managers on our individual team, and I'll be here today to help answer any questions along the way. And thanks for joining us.
All right. Thank you, Becca. Thank you for sharing your knowledge and time with us here today. And I'm sure our audience will appreciate that as we go forward. Let's dig into what we want to get done today. Two questions for you right here on the screen. Would love to see what you're thinking in our chat window. You can use the chat on the bottom of your screen to weigh in. What percentage of your clients hold multiple policies with you? And what percentage of your clients would you like to hold multiple policies with you? See a few responses coming in the chat. We see some of us are in the neighborhood of 10, 15, 20% that hold multiple policies with us. Some of us may be closer to 50. Curious about some of those. But nearly all of you, for good reason probably, are saying that you'd like 100% of your clients to have policies with you here today. And that's an ambitious goal, but it's one that makes a lot of sense, right? Because that means you're protecting your clients with some additional coverage, and selfishly, perhaps, you're also boosting your revenue stream coming in. So what we're going to talk about today is the follow-up appointment and the first quarter follow-up in particular, and how we can structure that to build it for success in your first quarter follow-ups and help with those cross-selling additional policies. And given that we're in the middle of the first quarter, maybe you ended OEP, AEP without that first quarter follow-up in hand. So we'll talk about some strategies for getting that follow-up if you don't already have that. So first thing we want to attend to today is structuring that follow-up for success. And we think that there is 3 ingredients you'll want to keep track of as you build those follow-up appointments. First ingredient is you want to make sure during that follow-up, your clients are comfortable. They have their plan materials, right? They have their ID cards. If they're in the Medicare realm, they have their OTC cards. And they understand their plan, right? They know what the benefits are. Maybe they have a reminder about deductibles, versus co-insurance, versus co-payments, all those sorts of things. Want to make sure they're comfortable with their plan because that builds a little bit of trust. We also want to make sure that we, point out why the plan that we mutually agreed to enroll in, right? It's a joint effort between you and the client. We want to affirm that decision and show why it was a great decision for them. That again builds some more trust, cements your value as the agent for that customer and with that customer. And that's an important ingredient for what we do in the third part of that follow-up, and that is providing solutions for potential coverage gaps. If you've got them in a great plan, they know how to use it, they feel good about their decision, they're more likely to trust whatever advice it is you have on the back end for filling some of those gaps in those plans. And we'll need to really attend to those first 2 things in order to be able to competently and confidently bring up those potential solutions for coverage gaps, and if we want them to listen to us. So we're going to talk about the relatively easier stuff first, and again, this is where a lot of Becca's expertise will come in as she gets into some of the nitty-gritty details about how to do some of these things. So when we talk about confirming plan materials, we're really talking about a few things here, right? We want to make sure that, of course, your members have received their ID cards from whatever carrier in a timely fashion. right? It's hard to use that coverage if they don't have their ID cards or can't access a digital ID card. So you want to make sure, first of all, they can access their coverage. So as part of the follow-up appointment, whether it's a phone call, whether it is a face-to-face meeting, or an email, we'll talk about that a little bit later, you want to confirm they can access their coverage, right? And honestly, we do hear from a lot of agents that, or you might hear from some of your peers, that this is a step that is often skipped. I think it's probably a better experience though, especially if you're in that stage of your insurance life cycle, so to speak, where you're in that growth stage, where you're focusing on growth. This right here really provides a better client experience than them calling you up 30 days later going, hey, where's my card, right? So check in with them, and we highly encourage you to do that to make sure they can use the coverage they've selected. Many, if not all carriers do send out welcome kits along with their plans. So all kinds of literature about the core benefits, the supplemental benefits embedded in the plan. There's all kinds of stuff. This is a good opportunity to talk about those, walk through those, and what they might say for your clients, especially, again, if you're in that building stage of generating your book. And depending on the plan and depending on the carrier, your client may also get welcome calls, especially for your DSNP clients in the Medicare realm. They may get welcome calls from a care coordinator with that carrier, generally somewhere between 15 to 30 days after their effective date. So you want to make sure that's happened, right? That they're getting the benefits that they maybe are paying for, but the benefits they're entitled to with their enrollment. And right here, this is kind of table stakes, right? If you checked in, you can confirm all these things happened. Great, and if your clients have all these things in hand, that is a great step for them. You're making sure they can use their coverage. Or if your clients don't have those things in hand, you've got a service request you can begin working on right away and showing that care and value you bring to your clients. Becca, I know you have a little bit to say about ID cards and welcome calls and where our agents might look for those as they work with their clients.
Yes. So, first thing I want to mention is members are going to be receiving those ID cards ideally within 7 to 10 business days after the policy has been approved. We get a lot of calls from agents saying, member never received the card, but it could be to the fact that they just haven't got it yet in the mail. So, always be on the lookout after applications are submitted just to make sure you're not missing anything. Something else that I wanted to mention was for our Medicare members, those OTC cards. They are reusable. We get so many phone calls about member lost the card or member threw the card away. Those are reusable and the amounts are reloaded back on at the end of the quarter. Something that's also worth mentioning, the OTC app is really easy to use. I know that usually the people on the Medicare plans, they're not so much tech savvy or they aren't willing to learn how to use the technology. But if someone is there to show them just like the basics and get it set up, it is really nice. It shows the amount of the card. It shows locations where you can go to, like a Dollar Tree or a CVS or something like that. It'll show on the app where you can go. And then it also shows which items are eligible as well. So it's super nice. If someone has time to sit down with them and set it up, it's worth it to me, I think. And then
Absolutely.
yes, as far as the welcome kits too, Debbie Brown actually brought in her mom's welcome kit, and it was this big packet. You can't miss it in the mail. It has so much great information the member can look through. So always be on the lookout for those things.
Yeah, I hear that. And just to sing Debbie's praises a little bit more, she actually showed us the OTC card earlier this week, and as we were kind of getting things together for this presentation. And it is the easiest thing I've ever seen to use. Doesn't require a login. Doesn't require anyone to remember a username or a password. All you got to do is type in the card number, and it shows you the balance, and it shows you all those benefits that Becca talked about. So honestly, really friendly way, consumer friendly way for your consumers to access their benefits going forward. The second part we wanted to talk about here today was affirming that great decision, right? So if we've taken care of making sure they have the plan, they have the coverage, we also want to let them know and work with them to help them realize just how great of a decision they made. And how well that coverage really fits what they've needed. So during this part of the appointment or during this part of your follow-up message, you want to do a few things. First, you want to show how some benefits influence the decision by linking that to a need you identified during that sales appointment. And where possible and appropriate, you want to be able to help them use the benefit. So here's what that could sound like. This plan comes with, or this carrier supports Livongo, which is a great solution for managing your diabetes supplies. Let me show you how to do that. Or you said in your appointment that you need help with some light household work, right? Maybe family doesn't live close by. Remember that this plan comes with X hours of companion care, and that can help with chores, transportation, or even just give you someone to talk to. Do you have that number on hand? And Becca, I know there's a few more ideas that you had in here that you commonly get calls about as well.
Yes. So the two that you just mentioned, Randy, are great. And if agents need more information themselves to get educated to educate their clients, give us a call because we can go through it with you as well. We know where to look, we know how to get the information. But I also wanted to mention something that I personally use with our Blue Cross insurance, and it's Blue 365. They have so many amazing deals on there. For me personally, I use the Active and Fit with the gym membership, and it is extremely discounted. I can't believe I can go to the LA Fitness down the road from me for like $30 a month, opposed to the membership that's usually 45. So it's just really worth it to take a look. I know they also do like meal subscriptions, and they have discounts to other retail stores. So just really great benefits that are included that members typically don't think about, or they just maybe they forget that they have them. So it's always worth mentioning and educating about.
Absolutely. Becca mentioned Blue 365 there by name, but United Healthcare's U Card, it does a lot of the same thing when your members go places. Same with Priority Health. They have their own set of value-added benefits. And if you need some education, you need to be beefed up on those. Again, give Becca or anyone on our team a call. We're happy to help you out. So let's check in with our audience here for a little bit. There's some benefits that your clients are drawn to, clearly, that in some cases, depending on your client, probably drive decisions for them. What are some of those benefits that drive decisions for your clients, and how do you bring them up here in the follow-up appointment, or how might you bring them up here? Okay, seeing more than a few of you chime in with silver sneakers, right? And that is available with many of the carriers that we work with as that fitness benefit. Becca, I know you had some, as we were preparing for this, you had some more to say about silver sneakers here as well.
We get lots of calls about like locations for silver sneakers. So it's super easy to use. You just go to their website and you would type in the member zip code. And from there, it'll bring up all the different gyms that are participating with silver sneakers. Because we'll get calls and agents will be like, well, member says my gym doesn't work with silver sneakers. And we're like, okay, well, let's take a look. Give us the zip code and we'll pull up where they can actually go to. So again, if you need assistance with that, give us a call, give the individual team a call, and we can help you find a place that is participating with your members' Silver Sneakers plan.
Thank you. All right, so we've done some of the easy stuff so far. We have made sure that our clients have everything they need to use their coverage. We've built some more trust with them by showing them some of the benefits in their plan and helping them access those benefits. Maybe they have a surgery coming up. Maybe we show them how to use the surgery decision support tools embedded in their plan, or their second opinion tools, or whatever the case might be. We've built more value for ourselves and deepened that relationship by showing them how to use their coverage. And now, for some of us, comes the hard stuff. And what we mean by the hard stuff is taking that first quarter follow-up and launching it or using it as a launch pad to talk about some ancillary products. I do want to share one universal truth with you here today, and that is that every major medical plan has gaps that expose your client's finances. Whether that is an individual under 65 plan, whether that is a group healthcare plan, whether that is a Medicare Advantage plan, whether it's original Medicare, there are gaps somewhere that leave your clients exposed, whether that's through paying a deductible, whether that's through high out-of-pocket maximums, or whether that is through paying co-pays or co-insurance when they get those, right? Nobody wants to pay $325 a day when they go for their inpatient hospital stays. Nobody in the individual market wants to pay that $9,000 out-of-pocket max, and nobody wants to pay a $7,500 deductible or a $3,000 deductible or whatever the case might be, right? Everyone wants to avoid financial pain, and there are ways as an agent that you can help. Some of you, by the way, would argue that the best time to bring up some of these policies, accident, critical illness, hospital indemnity, short-term care, is during that initial sales appointment during AEP, OEP. But we know that for a variety of reasons, the sale might not be made there. Maybe you didn't have time to bring it up. Maybe the client didn't have time to bring it up. You were just in and out making that core health sale. Maybe you weren't appointed yet. Maybe you hadn't been to a session like this. You didn't know how to sell them yet. Or maybe the client just said no to the product during that first sales appointment during AEP, OEP. That's possible too. But a no one time, a no in November doesn't mean there's a no in January, February, or March. Things happen over those, especially over the holidays, and especially with big snowstorms like the one we are just coming out the other side of, right? That could change how your clients feel about these products. So it could be a good idea to bring those up. We should also mention that any product we talk about here on our screen over the next few slides, whether it's accident, critical illness, hospital indemnity, or short-term care, they can all be sold year-round. Although, especially if you're working in the Medicare appointment, scope of appointment, or Medicare realm rather, scope of appointment rules do vary by carrier and by time of year. For example, if you want to talk hospital indemnity during your AEP appointments, you're going to want to make sure you have a scope of appointment that checks off that box or the ancillary benefits box. But outside of AEP, depending on the carrier, you may not need that scope to talk about these benefits. I'm not getting real deep into all those details here today. If you need some more product information or what your guardrails are, I encourage you to talk to our individual team when the moment arises. Let's talk first about accident coverage and who is a good fit for what the coverage does, why you might need it or why your client might need it, and give you a few ideas of maybe the hardest part of this whole process is how do you bring it up to your client? How do you crack open that door to start the discussion for the sale here? So talking first about accident coverage, it's a good fit for maybe anyone who's ever sprained an ankle or broken a wrist, or you've cut your hand in the kitchen, or maybe your kids are playing city league soccer and they sprained an ankle, right? Or they took a cleat to the shin and they needed some stitches or whatever the case might be. If your clients are at risk of any of those, and spoiler, they probably are, an accident policy could be a great fit for them. What accident policies do is that their benefit design does vary among plan and carrier. Some are built on a defined benefit schedule. So for example, a broken ankle pays X amount of dollars, or a severe cut to your hand, a hand laceration is what it would show up as on the claim. That would pay Y amount of dollars. Others, you can buy a benefit bank. You can buy a bank of $2,500 or $5,000 to draw from on the year and reimburse your clients can reimburse themselves as those costs arise. Your client's core medical plan, their risk tolerance, and their budget will, of course, determine what plan is the best fit for them, but that's generally how those plans can be configured. So why would your client be interested in these? A few different reasons. First, we talked about on the last slide about deductibles, co-pays, and co-insurance, about how nobody really wants to pay those obscene, in some cases, high amounts, right? So you can make your clients whole by indemnifying them against those sort of outlays. But there's also the opportunity here, depending on how you structure the benefit or how they choose to use the benefit, for some extra funds. Those extra funds could go toward housework or paying someone to take care of the yard while they're laid up with that bad ankle. It could go toward income replacement or wage replacement, or maybe just transportation costs. So depending on the injury, there may be a lot of different ways they use that benefit. And many carriers really don't care how they use the benefit, right? They just cared that your client was injured, cared that they were seen in an appropriate amount of time for that accident, and make the lump sum payment or the let your client draw from that benefit bank as the case might be. So how do you bring that up in an appointment? How do you suggest to someone that chances are good you're going to get injured and you might want to address that deductible or something else? Well, name the problem in the room, right? What resources do you have on hand to meet that deductible? And if you need some more talking points with that, the cash price for your average surgery repair a broken bone is somewhere between 17,000 and 35,000, right? If the break is bad enough to require surgery. Negotiated rates, of course, probably don't approach that. So carriers are probably paying a little bit less for that. So knock a few thousand off that figure. But one injury, one bad accident could mean you're paying that $9,000 deductible or out-of-pocket max real quick and be subject to all that right away. And that doesn't even talk about lost income, lost wages, physical therapy, or anything else. And so it's probably really likely that for less than whatever their out-of-pocket maximum is, they can pay the annual premium for their accident policy and makes it back some of what they would have spent on that deductible. Becca, anything to add about accident policies before we move forward here?
Yeah, I just wanted to add that I think it's really important for you as the agent to be actively listening to the client. Of course, we can't predict what's going to happen to us, and we all hope and pray that we're healthy and accident free, but life happens. So I think it's just really important to stay protected. And with these different policies, you can notice when it's a good time to bring it up to them. If you can't do it on that first initial appointment, you heard them talk about things. So bringing it back up is a great idea just to keep them protected.
Yeah, absolutely. A no in November isn't a no in January, right? So the idea of bringing it up is important. And also, since I've had kids, I don't think there's been a year where I haven't met my out-of-pocket max or my deductible. Especially when you're getting to know people during that discovery call, and maybe you know they have kids and you know they're active in sports or whatever the case might be, that could be a good opportunity to hold the accident policy in your back pocket and bring it up a bit later on. Let's also talk a little bit about critical illness, and or if you want to get real technical with your insurance licensing exam, they lump these together as dread diseases. So your heart attack, your stroke, or your cancer. In other words, these policies are a good fit for almost anyone with a risk for these three conditions. And something like 1 in 4 Americans does get diagnosed with cancer throughout the course of their lifetime. So it's not a bad idea to have that sort of protection in your back pocket. Generally speaking, critical illness plans will pay out for the first diagnosis or instance of that illness. You can buy a benefit, or as little as 70, as little as 5,000, go as high as 75,000, or anywhere between on some policies. And it's really a payout to help you pay for that direct cost of care, but also those indirect costs of care as well. There's some additional riders you could pair with these policies, as you might think return of premium or recurrence benefit. What if that cancer comes back, right? Will the policy pay out again? That's something to take a look at. Or what if I have a second stroke or a mini TIA after that stroke? Also something to consider there. Some of these policies do, oddly enough, build in dental and vision payments and critical accident benefits as well. So we just talked about accident coverage on the last slide. In some cases, depending on the carrier you're shopping with, hint GTL, you can go ahead and wrap your accident policy and your critical illness policy all into one. So why might your client be interested in that? Of course, offsetting those medical costs, but also provides for any cabinet care they need to rehab for that. Again, can help protect any lost income or provide return of premium. Maybe your client is absolutely one of the lucky few, right, that does not have a cancer diagnosis throughout their lifetime. Some policies do have that return of premium rider built on, that they can collect all the money they've spent here. So essentially becomes a no risk proposition for your client in that case. But it's never fun to talk about cancer. It's never fun to talk about some of these life-threatening diseases or illnesses. But you got to do it, right? If you want to bring it up to your client and better protect them from some of these things. So there's a few easy ways you can do it. You can say things like, "Tell me about your plans if you have a major illness," or "Who's your cancer policy with?" make it sort of matter of fact, right? Make it in that way, you're kind of making it sound like everybody has one. And there's a little bit of fear, a little bit of tension about why I don't have one, right? And that could crack open the door for the conversation. Becca, anything to add here around critical illness policies?
I'm just repeating kind of what I said before. I just think it's really important to listen and help the clients stay ahead of things. I mean, we don't know what's going to happen. We don't know if we're going to be diagnosed with cancer. We don't know if we're going to be in an accident ever. But being protected is just the best way to prevent anything from those large out-of-pocket max that are going to come up with these things that happen. So it's just listening, staying protected, giving the options, and knowing that the agent is there for the member is basically what I would throw into that.
Absolutely. Listening here is key, right? And identifying these needs. They're not all these policies are a good fit for all of your clients, and hopefully we're helping you kind of sift through the chaff here to figure that out. Another policy you could talk about during your follow-up appointments is a hospital indemnity policy. And these are the best fit for your clients who are in either zero or low premium Medicare Advantage plans. Um, although the issue ages for a lot of these policies sometimes range between 18 to 85, these products are really designed for your Medicare Advantage clients in those plans. What the policies do? Well, as the name implies, they indemnify, they make you whole for your hospital copays and do provide additional riders for other gaps. Maybe it is for a ambulance ride, right? Nobody wants to pay that $250 out of pocket every time they go to the ambulance. Let your indemnity policy cover it. Nobody wants to pay $50 a pop for your or outpatient physical therapy, right? Let your hospital indemnity policy handle it. And in many cases, again, the yearly premium for a policy like this is probably less than the cost of a one-day hospital copay and an ambulance ride that it takes to get them to the hospital. So again, there's a good financial sense to investigate this sort of protection here. And like the other policies we've talked about, they can offset hospital costs and your other costs associated with care. And what's also important, and we should mention about all the policies here so far, at least depending on the carrier you go with, is that they're lump sum payments directed to the beneficiary. Your clients don't have to use these policies to pay for their care, right? Maybe they want to use them to fund their next golf trip, and that's okay too. What these policies do, though, is they make them whole for the loss they made or the loss they incurred when they were in the hospital. What they do with the funds after that is entirely up to your client. And how you bring those up is a lot of people kind of need to see the holes in their Medicare Advantage plan, right? A lot of people, for a variety of reasons, see Medicare Advantage as like the end all be all, right? As this takes care of all my needs. It doesn't. You've got to show where those gaps are. And one way to do that is with a worksheet that kind of shows you how the benefits stack up. This is what we call our less intensive worksheet and kind of built for a high level view of how these products work and where the gaps are. All you need to do is put in your client's benefits, so $350 for that daily copay from 6 days, see what their benefit looks like, and all the worksheet does is kind of totals up their total potential Medicare expenses and matches it up with how much they could get from the ancillary benefits if they were to buy all those benefits as part of the plan that you build with them. And of course, shows them and your client the total cost of purchasing that protection. So for the cost of $44.25, we could protect ourselves from up to $10,950 of loss here, right? Maybe make a little bit of money if we do end up in the hospital. Not a bad deal for your clients, kind of walking them through those benefits, showing them where the holes are. Some of your clients like to go in more detail and look at all of the benefits. This worksheet does the same thing, but goes deep into ER services, ambulance services, outpatient surgery, outpatient therapy, some of those really nitty-gritty details of the plan. I bring these up because A, they're great sales aids to go through the conversation, but B, because I'm happy to get rid of the logo here, get rid of the footer down here, put your logo, your footer there, so you can use this right off the shelf and start talking to your clients about them. Becca, anything to add about hospital indemnity before we talk about our last group of products here today?
My personal opinion would be this is a no-brainer. I mean, if you look back at that chart that Randy had up, the total amount that the client would be paying, $44.25 for all of that coverage, is a no-brainer. And like he also mentioned, if you want us to send you over these worksheets with your logo and your information on it, we're happy to do so. I think it's a great thing to have when you're sitting down with a client.
Yeah. And, to kind of put that $44 number in $44.25 in perspective, right? Depending on how your client is rated and depending on what riders they buy here, you could kind of get really close to what some Medicare supplement coverage looks like for about a third of the price here, right? Depending on what your client is rated, what they're uh, interested in. Of course, there's some complexities in using that coverage, but there is a lot of value to be had here for your clients, should they be willing to investigate it. Lastly, want to wrap up with short-term care here before we move to our second part of today's presentation. So short-term care is, of course, probably a better fit for your elderly clients who are more likely to be incapacitated for an amount of time, but could be a good fit for almost anyone. What these policies do is provide coverage for up to 1 calendar year of in-home care if 2 or more activities of daily living can't be performed. So your toileting, your bathing, your dressing, those sorts of things, right? If for whatever reason they can't do 2 of those 7 things, this policy would kick in. And there are some additional riders available to help offset additional benefits here. Here's the biggest reason your clients might be interested in it, though, is depending on the care requirements, right? Depending on how many ADLs your client can't perform or what assistance they need to perform those ADLs, the average yearly cost for a home health aide, so someone to come to the house, take care of your client full time, is about $56,000. I don't know how many of your clients have 56K lying around in their bank accounts, but this could be a good way to protect against that potential expense, especially if they find themselves disabled for a short period of time. And the way you bring that up is, or a way you could bring that up is, who do you have to take care of you if you can't take care of yourself? Do you have family nearby? No? Would you need to rely on a home health aide, or would you really need to rely on outside care? I have a solution that can help you pay for that. So lots of different things to consider as you work there. Want to check in with you all for a bit, though. Want you to think about the current makeup of your book. What ancillary product or products could be a good fit for the greatest percentage of your current clients? Do you skew more under 65, where an accident policy could be a good fit? Do you skew more Medicare, where hospital indemnity or short-term care could be a good fit? What makes sense for you? Seeing for some of you, again, that hospital indemnity is a natural fit. Some of you think you're curious about accident, that could work for you. Yeah, there's lots of possibilities here, right? And lots of additional sales here that could help protect your clients, but also boost your income stream. Let's talk a bit about how we get that follow-up then, right? We're here in the middle of first quarter. First quarter is all the way underway. Maybe at the end of your appointment, your AEP, OEP appointments, you didn't get that follow-up. How can I work to get that follow-up here in the middle of first quarter? I do want to let you know that, of course, the best time to schedule a follow-up meeting is at the end of every client meeting, right? Your clients should know when you're going to talk with them, right? That it's kind of like setting your follow-up appointment with your doctor. Here's when I'm going to take care of that condition. Here's when I'm going to go the next time I'm going to see you, right? Builds that sense of trust, build this sense of a lasting relationship. Not that you're only there on their radar in their lives for a month, 3 months in the fall every year. But of course, if you didn't do that, the next best time to schedule that follow-up meeting is today. So let's talk about how we can do that. If you don't already have that follow-up in hand, there's 3 things you might want to consider here. First one is leaving a voicemail on a 2233344 basis. What does that mean? Looking around and talking with a lot of sales professionals that we work with here, There's a lot of different thoughts on the follow-up voicemail and the follow-up cadence. What I provide here is sort of a sample cadence that you could follow. By no means do you have to do it. Just want to do it exactly like this. I just want to give you one way it could be done. That 223344 gives you 7 touches with your client built in. And the 2 or the 3 or the 4 stands for the number of business days between touches. So if I reach out to my client today, don't hear from them, can't get them on the phone, might try again in 2 days. If I don't hear from them, might try again in 3 days, 3 days, 3 days, then 4 and 4. Eventually your client's going to do one or two things. They're going to pick up the phone, or they're going to say, not interested in talking right now. Either way, you can close that, right? And of course, through those voicemails, you can vary your voicemails and what you say in each one. We'll show you some ideas for a script there a little bit later on, but that's a good way to kind of open the conversation there with your clients, make and get their attention going forward. Some of you aren't comfortable with that sort of intense cadence, and that's okay too. You could try emails, and we'll show you some ways to try that here. And we can also talk a bit about snail mail. And there's a bonus if in that snail mail, you can also broach a new policy to your clients. Becca, anything to add around these strategies before we go into those a little bit deeper?
When we were preparing for this, I had never heard of the 2233344 basis, so that was fun to learn about for myself personally. But I also like the snail mail approach as well. It's always nice to get something in the mail with your name on it, and just you can follow up from there with them. I mean, I think all three are great options. Just find which one works best for you and stick with it.
Yeah, absolutely. And that's important, right? Some of these things might not work for you. They might not feel great for you in your personal sales style and your personal approach to customer service. That's why we're giving you a bunch of things that you could try. You can pick something that works for you. If you are in the middle of meetings, though, or if you are talking about meetings, we do want to also point out to you another way that's kind of easy, I think, to get the follow up at the meeting or get them talking about other products at your meetings, and that is by showing the full menu. What does that mean? You go to a restaurant, right? And you don't just say, I want a cheeseburger, I guess, unless you're a regular there and you know the menu and you know what they have to offer from top to bottom. But you read the menu, you look at your options and say, I like that. Or waiter, I have a few questions about that. Or the waiter comes over and asks if you have any questions. You say, no, I'm good. I know what I want, right? The waiter doesn't have to recite everything from memory, and there's no danger in the waiter forgetting things, right? If you have that menu in hand, they can't leave anything out, right? You're looking right there at the menu. So what happens is by showing the full menu of what the restaurant has on offer, you can choose from anything, ask questions, start a conversation about anything. And we'd like to bring that kind of same analogy to your insurance agency. Where you have the option, where you have the ability, and you probably do, is to show the full menu. Show your clients that you talk about Medicare products. Show them you have hospital indemnity or cancer products and so on and so forth, whether that's on your business card, whether that's on sort of a flyer at your desk or whatever the case might be. If they don't know you have the product to offer, they can't ask about that product. So that if there's only one thing you take away, I encourage you to show your full menu. And if you need help building that, again, talk to us. We're happy to help you do so. Another way, again, you could get that follow-up at the meeting, and we'll talk about some other ways, if you don't have that follow-up in hand already, is by having some really visible collateral in hand as well, right? Sometimes just having that flyer for your clients to take a look at could spark the idea about hospital care, could spark the idea about accident policies or cancer care. We're happy to customize some flyers like these for your agency here as well by putting your logo there, your contact information, your color scheme, and again, give you some tools to start that conversation. So when Becca and I were talking about snail mail, what we meant is handwriting that letter, handwriting that envelope, and giving something off to your clients for them to consider. But you can make it easy on yourselves, right? You don't have to write a 5-paragraph letter to everyone. It could be something as simple as folding up a flyer or folding up a brochure from one of your carriers or one of your products you'd like to talk about and giving a handwritten note. Lots of my clients are adding this to offset their hospital costs. Call me if you'd like to learn more, John, and then leave your phone number. The power here is in the handwritten note, right? First, there's that handwritten envelope. There's also the handwritten note here. And you provide some social proof by saying some of my clients are considering this. Could be a way to get that call back from your client when this hits their mailbox. And again, if that snail mail isn't working for you or you didn't get it right out of the reading, sometimes you just can't connect with your client. So how else can I get close to doing that follow-up? Well, one of the ways is by doing voicemail, right? We have a few scripts prepared that you can borrow here as well. I want to point out a few elements of this. First of all is, reminding your client here in the middle of January that their Medicare plan or their individual plan is now in effect, and connecting that to that value added benefit, right? So making sure they receive their ID card, linking that back to the fitness membership, affirm the value of that decision, and also introducing a benefit which could be a good fit for them. So there's also a first diagnosis cancer benefit that can be added to your plan. Even though your health plan covers much of your medical costs, that benefit can address non-medical costs. Let me know if you'd like to learn more. So it's not the full depth of the discussion you might have during an actual face-to-face meeting, but you're doing a lot of the same things you could do in the meeting with a voicemail like this. You could also try an email like that as well. So you could say, dear client name, thank you for allowing me to help with your Medicare planning. Don't forget your plan has whatever benefit is that we talked about, and that was a difference maker for you. And also, if you do need to go to the hospital, we have this plan that could offset your costs. So there's some email scripts we have on hand. Happy to share those with you here as well as you're thinking about how you get that follow-up or how you bring up those ancillary policies a little bit later on here. What are some other strategies that could be helpful in securing a follow-up? Okay, some of you saying that call cadence might be a bit too aggressive for your taste, and I get it. It's just a place to start the conversation, right? And a way to kind of reinforce the idea that sometimes one call, one voicemail, one email isn't enough, right? So find a cadence that works for you, but don't give up after that first call.
Finding what communication technique works best for you and your clients. I know a lot of our agents are traditional, they'll reach out phone, email, but maybe trying something new this year. It's 2024, maybe try something new. Maybe the snail mail could be a good option for you this year. Give it a try and I guess let us know how it goes.
But we'd love to hear more about those marketing successes and even those some of those challenges you're having as well. Would love to help you either hone in on what's going well and do that even better, or help you maybe right the ship if things aren't going as well as you'd like. We showed you a few worksheets today. We showed you a few lead behinds. We showed you those scripts. We showed you those tips. If you need any of those, or you like any of those, we like any of those customized for you and your agency, please reach out to, you can reach me directly at learning@actionbenefits.com. Your account manager can also help you and put you in touch. Becca, before we close out today, what are any final thoughts you have to share with our audience?
I just want to say that I know we talk a lot about reaching out to your account manager. If you do not know who your account manager is, that's okay. Give us a call at the office number right here listed and just say, hey, I'm not sure who I'm supposed to be reaching out to directly. Can you help me with that? Because I know a lot of the time agents are like, I'm not sure. Should I reach out to someone directly? Should I not? Either way, we have a team that's happy to help anybody. And then, of course, we have our account managers who are there for anything else as well. If you need a little bit more time with something, you want us to schedule some time to sit down with you, we are happy to do that. So just give us a call and let us know what you need. We are here for you.
All that said, ladies and gentlemen, I want to thank you for your time and attention here today. On behalf of Becca and the rest of the Action Benefits team, stay warm out there on this very chilly Wednesday, and please enjoy the rest of your days. And we look forward to seeing you again at the next Action Academy session. Enjoy your day.